Hi everyone, I'm Dr.Karam, board certified facial plastic surgeon, and I specialize in facial rejuvenation. And today I'm going to give you some predictions about trends in the field of facial plastic surgery for 2022. It's going to be somewhat intuitive. I think you're going to agree with most of my predictions here. Definitely these are areas that I see a boom in a direction, and let me know what you think after you've had a chance to listen to them. So without further ado, let's break it down. Trend number one, non-surgical facial rejuvenation procedures have been trending downward, and I believe that trend will continue to gain speed and momentum going into 2022 and beyond. And I'm going to talk to you about the reason why I think that's all happening in a moment. Trend number two, surgical procedures, facial rejuvenation procedures, facelifts, blepharoplasties, etc. on the upswing. Massive upswing starting around 2020, gaining speed in 2021, and I think there's going to be a huge explosion in 2022 and beyond, and we'll explain that in a moment. The third, anti-aging skincare. Very, very early in the process, people are still super confused, and I'm going to talk to you about what I am personally doing to help with that aspect. So let's break this down. So number one, non-surgical facial rejuvenation procedures. Why are they trending downward? We saw that for the first time, I believe, 2020, when fillers actually took a dip, the first time in like 10 years. Why is that occurring? Well, here's the reason why. We have had about 10 to 15 years worth of observation of all these different types of procedures that are designed to circumvent or basically substitute surgical procedures such as the facelift. And what we have generally come to the consensus, and I think without a question, is that none of them work. Now, I'm not being biased here just because I'm a surgeon. You got to remember, as a surgeon, I can do every one of those non-surgical procedures. In fact, I don't even have to personally do them. I can have my nurses and nurse practitioners run all of that stuff while I'm in the operating room doing these type of things. So if anyone has anything to benefit from it, is somebody like myself who literally has an entire facial rejuvenation practice. I could do both of these things, but honesty and integrity are important components of being a doctor. And at the end of the day, I have to be honest with myself and honest with my patients. When something doesn't work, it doesn't work. And we've tried different things along the way. So here's what it breaks down to. Fillers. People have used them to lift the jawline, lift the neck by packing it into the upper face, packing it in along the jawline. Guess what? Jawlines and necks still sag. All you have had is a mid-face that is really big and swollen looking, and a jawline that looks really heavy and wide. Not a good look. Definitely not the look that you had when you were in your 30s, and definitely not a look of somebody who looks rejuvenated and fresh. We've learned our lesson the hard way. We've watched these observations, trying all different types of techniques. Fillers in that type of way just don't work. Second, threads. Been there, done that. That's been, that hit the market 15 years ago, then went away completely, and then all of a sudden found a new life in the last few years, these PDO threads. Well, completely illogical treatment. And I think people are starting to realize that. I think practitioners, again, who are being honest with themselves, realize that these things, even if they work just a little bit, but they're super temporary. What's the point of treating a problem that is evolving? Aging is an evolving process. The fascia is getting longer, all these things are happening. Jawlines are sagging more each year. So why put in something that literally disappears in about 6 months to give a little bit of a change that is so temporary? People are getting the idea that it's simply not worth the money. The third area is these devices, Ultherapy, Thermage, you name it, all these, Morpheus 8, the list goes on and on and on. And just every other day I feel like there's a new device out there. They have never worked. They've been around forever. They never have worked to lift the face in a proper way. People can imagine a little bit of change here and there at best, or no change at all. And again, every time I post about something like this on my Instagram, I get tons and tons of reactions and comments about how their experience is exactly as I described. So those devices generally don't work, but on the flip end, it also causes some harm. Putting energy and heat into deeper layers of the skin where they're fat in the subcutaneous layer oftentimes melts away that beautiful and very valuable fat that creates that supple softness to the face. And that is a negative effect of these treatments. So personally, in our practice, we've never done those. We've never done threads either. We've used fillers for different ways to try to emulate some type of lifting effect, and they have definitely showed us the light, and we've stopped doing those type of treatments as well. Surgical treatments, trend number 2, positive. Why is it getting positive? Well, we all have, I think, a healthy dose of fear and trepidation towards facelifts. Traditional facelifts, the stuff that we have grown up with and seen and still see today, many of them are in the horizontal vector. The face goes sideways, face looks pulled tight, etc. Who wants that? But in the last couple years, what has happened is surgeons like myself, who, by the way, my surgical approach is called the vertical restore. It's a trademarked and patented procedure that is different than a traditional facelift in almost every way. And there's a lot of videos that I talk about this, so you can hang on and listen to some of them after this particular video. But the concept of vertically lifting the face, bringing it upward, going into the deep plane, lifting the entire face, the lateral brow, the mid face, the jawline, the neck, in this upward direction in the deep plane, which is what the vertical restore is, creates an incredibly natural look. Other surgeons who also do deep plane surgery, who create natural looking results, have basically started to put their results out on social media, etc. So a lot of people start looking at those results and saying, wow, I can look natural, I can look rejuvenated, I don't look like I've had any work done, I don't look like a different person. Why not? It changes the perspective. The fear that you've had once towards the traditional facelift, you realize there is a better option, and it's effectively 10, 15 years worth of enhancement and results. Liberates you from having to do all these different things every 6 months in the offices of medical spas and practices, etc. And you're like, of course, our practice is packed doing these procedures. You as an individual need to make sure that if you're seeking this out, you're seeking a specialist who does these type of procedures, who does them the way I describe them, in the sense that they look natural, unoperated, and that you're not getting a traditional facelift just because facelifts have become so popular again. So you got to be a little discerning and careful as you're navigating and deciding on who to use for these procedures. So that has been a very, very, I think, helpful aspect in terms of bringing light and enlightenment to the idea that, surgery can be extremely, extremely effective and positive when done by the right surgeon using the right techniques. So I think that accounts a lot for this increase in trend that we're seeing. The third area that we're seeing is the desire to address the skin in a proactive way. Now, the skincare arena is beyond confusing. I have to say, it took me a long, long time of study and understanding and questioning and all this stuff to really get down to what are the important active ingredients that you need on your skin on a daily basis in order to really fight the aging process, to defy the aging process of the skin, and to get that beautiful, bright, youthful glow. It wasn't easy. Trust me, it's not laid out there very simply. It's still not. What I did personally for my patients, my surgical patients, about 5 years ago, I decided I'm going to try to make it easy on them. And I set out to develop my own skincare product that was literally just like an all-in-one, have everything in it from like retinol, vitamin C, niacinamide, peptide, growth factor, squalene, lipids, hyaluronic acid, lightening and brightening agents, and firming agents, and all these different things to put it all together and make it super simple for our patients to use. Well, 5 years ago, it was just designed for our surgical patients, and it took about 4 or 5 years to develop. And now I can speak to this and help people who are wanting to find an easy solution to this problem of too many steps, too much complexity, too much confusion, too expensive. I mean, when you're talking about doing all the right things, you're talking about like 8 to 10 individual products. And the trifecta, which is the product that I developed, it's a 3-step process, basically consolidates all this and makes it super simple. This is what people want. And we're starting to see a lot more people taking active measures with sun protection, which is absolutely at the foundation of anti-aging of the skin, wearing broad spectrum sunblock, wearing hats, doing all these things. Now, if you're listening to this, you're wondering, okay, what should I do? Well, start with sunblock. right? Broad spectrum sunblock like L10D, one of these, have zinc titanium in it. Number 2, get on a product like the Trifecta. Make your life very simple 3-step process, done. You've got everything you could possibly need. Then, where do these procedures in the office fit in? Well, basically, once you've got those 2 parts under control and you're doing them on a regular basis, literally when I mean regular basis, like every single day forever, the next thing is, depending on your age, you start doing some microneedling, you start doing some superficial lasers, you start doing some chemical peels to treat specific age-related, skin-related problems. But none of that stuff is useful if you're not doing the proper skincare. So the trend that I see in 2022 is a positive trend towards preventative measures, as I mentioned, and using skincare products effectively, as well as using office-based treatments effectively, not the other way around where somebody gets a laser, a deep laser like once a year and thinks they're doing all the right things for their skin. That's not the right thing. I'm personally on a quest and a mission to help you guys really understand what you need to do so that you do the right things and you get the most out of it effectively and efficiently. So basically, there you have it, folks. Those are the 3 anti-aging 2022 predictions. I don't think I'm going to be wrong. I see a lot of heat building in all 3 of these areas, and we'll go back at the end of 2022 and see if I was on mark on this. But there you have it. I talk about a lot of these different things in different videos, so make sure you follow along, scroll through our channel, and see what we've got. I'm going to always be honest with you, always set you all straight, and try to find the clearest path to the point where you can look as young as you feel and do it in the most efficient and safe way possible. If you haven't already, make sure you subscribe, like, comment below questions you have, help get this out to your friends and family. Follow along my other social channels as well. I put out daily information on my personal Instagram, Dr.Karam, and for more skin information, follow Karam MD Skin. If you want to look into the Trifecta and potentially start using it, go to the website KaramMDSkin.com. Guys, thanks again for your support. Our channel has grown and this community is building, which makes me very, very happy, and I get more encouraged and more inspired to share good information with you all. Thanks again, Dr. Karam.